Good afternoon, everyone, or good morning. My name is Rochelle Seeger. I'm with the Foundation for Healthy Kentucky. Welcome to today's webinar as part of our Health for a Change training series, Transforming Kentucky's Public Health System and the Critical Role of Community Collaborations. The Foundation for Healthy Kentucky's mission is the unmet health needs of Kentuckians. We do that by developing and influencing policy, improving access to care, reducing health risks and disparities, and promoting health equity. The Foundation values integrity, respect, effectiveness, leadership, policy equity, and collaboration. And in Kentucky, if you all are here, I couldn't resist showing a picture of a cicada. I usually put in a nature picture, but I just could not resist today. I was in my front yard a couple days ago. I want to let you know that the Foundation for Healthy Kentucky will have our annual Howard L. Vose Memorial Health Policy Forum September 20th and 21st of this year. Please mark your calendars and save the date. This year's forum will be Kentucky Vaccine Policies, Myth, Messengers, and Messages. You can find out more information at the Foundation's website, Healthy-KY, the Events tab, Vose Health Policy Forum. This series, Health for a Change, the Foundation began in 2011 to support and share the great work that's happening across Kentucky with health coalitions and leaders across the state who are improving health for all Kentuckians. An archive of today's event will be posted with slides and the recording at the Foundation's website, healthy-ky.org, under Health for a Change. Finally, again, Rochelle Seeger, I'm the Community Health Researcher Officer here at the Foundation for Healthy Kentucky. I'm thrilled you are joining us today, and I'm thrilled to present this webinar in partnership with CEDIC at the University of Kentucky, and I'd like to turn the call over to Melody Nall. Welcome, Melody.
Thank you, Rochelle. It is so good to be here with you and everyone. I am Melody Nall. I am the Engagement Director with the Community and Economic Development Initiative of Kentucky at the University of Kentucky, and I'm excited about today. Just a bit about us. I want to share our vision. Our vision is engage communities and vibrant economies, and this guides our work as an integrated center of research and community engagement. We're designed to empower communities to find solutions to their needs and issues across all of our work areas. We're data-driven and we're centered on evidence-based practice. You can visit our website, I'll share that in a moment, and you can check out our county data profiles. And they're on a wide variety of topics, from the economy to budgets, broadband, education, health, and more. You can learn about our work from economic development and beyond. These are the pillars of our work, and you can see there we have 5 that we work under in our team, both our research and our engagement team. Today, with me living in the health world, we'll be focusing on our healthy communities work. You can see some of the items here listed. This is where my work falls, and my career path from a public health educator and program manager years ago at the Purchase District Health Department to now leading community health needs assessments with hospitals across Kentucky and supporting health coalitions and networks with a community and economic development organization has been quite the journey. But I've met so many people and have developed so many wonderful relationships. Last fall and winter during COVID, I took the opportunity to interview numerous health coalition leaders, some very experienced and some new. And from that, I heard about successes and challenges that they're facing. And because of those conversations, I proposed to Rochelle, how about we highlight the work of Kentucky Health Coalitions and also partner with experts on new models and new concepts. And that's what brings us here today for this webinar. A quick message here. This is just to let you know, Dr. Allison Davis, our director, isn't here because she is doing a webinar on another platform on our new center. It's the Center for Economic Analysis of Rural Health. It is new. We are developing data tools and doing research that we think will be beneficial to your communities. So really just letting you know it's here. Check back with us. You can see the website there listed at the bottom of this slide. And this is my contact information. And I just want you to feel free to reach out to me if I or anyone from the SEDIC team can be of service to you in the future. Again, I'm excited about this time together. I'm excited about our presenters. And I'm happy to turn this over to Jan Chamness right now. Jan?
Well, thank you, Melody. And give me a minute and let me share my screen. All right. Let me try to get my presenter's notes back up here. All right, well, thank you again. Thank you to the foundation and thank you to SEDIC for inviting me to be a part of this Health for a Change series today. Just a little bit about me. As they said, my name is Jan Chamness and I am with the Department for Public Health. I'm the director of the Division for Women's Health. And I come to you today as the Public Health Transformation Project Lead for Kentucky. And I actually served as a local health department director for a little over 22 years in Montgomery County. So that's where you might recognize my name from. But boy, this is an exciting time to be in public health. For those of you who have been either directly or indirectly involved in public health throughout the years and in Kentucky, I'm sure that we were all faced with the challenge of really explaining what it is that public health does. And it's unfortunate that we had this pandemic impact our world, but it really allowed public health to highlight what it is that we do and why it is so critical to our environment and to our society. And so it really launched, put us on a good trajectory to really explain and really validate how important public health is in Kentucky and throughout. And it also allows, as we move forward into what I'm going to talk about today with public health transformation, you know, we launched this initiative back in 2019, and a lot of things had to go on hold during the COVID response effort because it was just an all hands on deck situation, at least initially. But I'm very grateful that Dr. Stack, our Commissioner of Public Health, recognized that we needed to put public health transformation back on track, even at the height and despite the response that we were having to conduct throughout Kentucky, and recognized that resources had to be committed as we move forward with transformation. So the objectives that I'm going to try and cover in our time today is to just go over the purpose and the process of Kentucky's public health transformation. I'm going to spend probably the majority of my time on that today. I would be remiss if I didn't emphasize the importance of community collaboration, since that's the topic of our conversation today. And then I'm going to point out some examples of transformation in Kentucky so that you sort of get an idea of what we're talking about. If we were all sitting in a room, I would ask by a show of hands how many people had seen this particular map back in 2019, and I dare say that many of your hands would be raised because this really set off or set in motion a lot of reaction to public health transformation and where we are today. this was, I like to say that this was this kind of launched a very reactive situation in Kentucky, because we knew, in looking at this insolvency map, and as a result of Kentucky's pension crisis, then we learned how the pension crisis would impact our local health departments. We learned a lot of new terminology that perhaps people who weren't in public health had never heard of before: quasi-governmental agencies. We learned about employer contribution. We learned about unfunded or underfunded pensions and what that meant and what that might mean to Kentucky's local health departments. And so we knew that something had to be done to make sure that these red counties did not, their health departments did not shut their doors, and even larger than that, knowing that that was the immediate need, but we also knew that all of the local health departments, even though they might not have been at the point of closing within months or even a few years, it was not a good path that local health departments were going to be faced with if we didn't make some changes. So that kind of launches me into why public health transformation. Why was it not just, you know, this reactive thing? And I think it's a lot bigger than that. Just FYI, I'm not a big fan of reading slides to you, so I'm going to hit the high points, and that's why they're going to provide the slide deck to you afterwards. But it was more than just the physical instability of local health departments. It was also just our current programmatic services were not reflective of community needs. I think that those of us who rely a lot on grants and grant funding are guilty sometimes of going after grants because of the money, and maybe not necessarily because it's reflective of meeting a need in our community. So we really needed to look at that. We know that a lot of changes have occurred at the state and the national level in our healthcare system. And so we've not really, public health in total has not really kept up with those changes and not pivoted to reflect a lot of those changes and how they impacted public health. There's also the legislative issues. As we continue to move forward, we knew that our statutes and our regulations were dated, that they limited us on how much we could move forward with transformation, how much we could sort of redefine public health in Kentucky. And so we knew we had to look at those. And then we have this unique governing structure in Kentucky, along with, I think, 3 or 4 other states that have, where local health departments are truly very autonomous within their communities. They are governed by boards of health who, rightly so, reflect the needs, unique needs of their communities. And so they want their health departments to address those needs, while the State Department for Public Health is trying to address the needs and provide resources to local health departments across the state in an equitable manner, in a fair manner. And so there's just this challenge of what we call shared governance. I have to spend a little time just on defining transformation. I think that for our purposes here today and just in moving forward, as you hear the term public health transformation, it's important to point out, this is not just a new program we're going to start. It's not just this thing we pulled out of the air. It really is a dramatic change. And so when you look up transformation in the dictionary, it talks about, a marked change, an extreme or radical change. And so when I was hired by the state in 2019, I really had an opportunity to kind of step back and look at transformation and what I felt like transformation needed to look like in going forward. And so I provided the commissioner at that time with sort of these overarching assumptions. I believe that transformation is irreversible. I don't think that it's something that, as we continue to evaluate and look at public health and moving forward, I don't think that we're going to go back. It's not, it's not something that we're going to say, no, we don't like this, we're going to go back to the way it was. I think it's irreversible. I think it's going to be a very radical change in how we do business. I think that it has to build into our strategic direction in moving forward. I think it's important to point out that if we're asking local health departments to change the way they do business, and they're our key partners, then the state has to look at the way that we do business with not just local health departments, but with our other partners throughout the state. And as I said before, even though that financial insolvency map is one that, you know, kind of set us on this trajectory of public health transformation, when you really get down to it, it's just the right thing to do. Yes, we need to do it from a financial standpoint, but it's really just the right thing to do to reflect, to be more in line with healthcare and public health in the future. When I do this talk within DPH and within local health department staff, and even within my own staff, I talk about this strategic mindset. And that's the culture that we're trying to create in public health in Kentucky, is that if we have this strategic mindset, in other words, if we think long-term, if we think with this visionary lens, this big picture lens, then it will determine the actions that we take. And hopefully those actions that we take aren't just temporary, that they result in policy change, possibly infrastructure adjustments, or building new infrastructures and expanding our networks. And then ultimately, it will get the results that we want, which are transformational. There will be more mission focused in terms of health outcomes and health behaviors and health access, because, you know, we still have a lot of work to do in health outcomes in Kentucky. And so, you know, it kind of stands to reason, this logic that what we're doing is not really working that well. And so we really need to transform public health to be more responsive to those. Did I go backwards? Yeah, sorry. So when the commissioner during 2019 was faced with this situation of the pension and this financial insolvency of local health departments, then he pulled together a group of local health department directors that he called his advisory committee, and they set about to try to determine what does transformation look like? If we had to draw a picture of transformation, what does it look like? And so this is really our first guideline, this first pictorial of what transformation looks like. And it was really an attempt to begin to prioritize and categorize public health programs and services into these boxes. And so this core public health box contained those foundational public health services and those other blue boxes of WIC, HANDS, and those programs that addressed substance use disorders and included harm reduction initiatives, that those would be the priorities that we would share across the state. And so that there would be some consistency and continuity in terms of these available programs being offered across the state in a consistent manner. The foundational public health box really contains most of our legislative and regulatory public health services, and really sort of what launched public health many, many years ago, long before all of us here. And then those buckets of WIC and HANDS, which have typically been offered through local health departments and these other initiatives. And that left this green box of local public health priorities. And I want to caution you to not put a whole lot of stock in this term local, because that doesn't mean that this green box just applies to local health departments. It applies to public health in general in terms of how each local health department identifies what their unique needs are and what programs might be available for those to meet those needs. And so that's how the public health transformation law was really built. It was built on this, this illustration of this categorization. And now we have these statutes and these regulations that set about that they were passed in an emergency bill last year and officially passed during the legislative session this year, that this would become the new public health beginnings in Kentucky. And so there were a lot of things in the law and in the regulations that addressed this green box. You know, the blue boxes, they're pretty straightforward, and we're all somewhat familiar and comfortable in offering those programs. But when it came to determining these local public health priorities, then the regulations really spelled out some of this new terminology that was going to have to be talked about as far as how local health departments would choose to offer these programs. The local health priority was the first term. It had to be followed by a local needs assessment. There had to be a data-driven need. Evidence-based programs have to be used to provide these programs. Health departments have to show adequate funding and sustainability. Has to be a performance and quality management plan involved, and an exit strategy. And it's important to talk about the exit strategy because I think that that really gives local health departments the option to say that if this program, or if there's no longer a need for this in your community, then what is your exit strategy? How do you notify your community, your stakeholders, the state? How do you work with other partners if you can no longer offer this program, but there's another provider or partner within your community that can? So it's important that we include that in the conversation. So where did this relaunch start of transformation? As I said earlier, it initially launched in 2019. It was kind of going along, but not with any real structure. And then COVID hit. And so then Dr. Stack asked if I would head up this public health transformation relaunch back in July of last year. And so we really had to look at all of the initiatives that we had done to date. We had to really take a look at some kind of structure that we would use to move this forward. We had the benefit of having ASTO provide technical assistance. We had to get commitment from leadership at both the state and the local level. We knew that there were certain things that we had to take into consideration, like personnel and finance and other regulatory impacts. So we really had to formalize our process in moving forward. And so you might be able to tell I'm kind of a visual person. And so we set about transformation in terms of these 6 buckets. Some of them were initiatives that were already underway, and they just had there hadn't really been any action in moving forward. Some of them were things that we really had to get on board with. We knew that data management had to be included because we just know that data management is such an important part of what public health does at the very foundation of public health. We're data people. We act on data. We make decisions on data. And then on the right-hand side of your screen is the current strategic map, and it was actually initiated in 2010. It really hasn't changed a whole lot. And so we knew that whatever we did with transformation had to translate into how we would move forward with a strategic directive, and that it had to align with these current pillars of our strategic plan. It's important that we highlight the importance that health equity plays, and not just in transformation, but in public health in general. And so I pointed this out when I talk to people. For those of you that have studied public health and have been in public health, you're familiar with the 10 essential services on the left side of your screen. And if you remember when that first came out, and I'm dating myself, but research was in the center, played a central theme in the 10 essential services. And now that has since been replaced with equity. It's not to say that research is not important. It still plays a role in public health, but equity now takes the center stage in driving these 10 essential services. Likewise, with Public Health 3.0, which was introduced in 2016, they've now also added health equity as a central theme in those 5 pillars of Public Health 3.0. So in order to make sure that we were successful in moving this huge initiative forward, we had to come up with a process, a mechanism to organize all of this work. We had to create some kind of a reporting structure, accountability structure, allowing for teams to take on to prioritize this work, we knew we couldn't just have one big work group called Public Health Transformation. There had to be a structure in place. We wanted to make sure that we engaged people at all levels. We wanted frontline staff. We wanted local health department staff. We even wanted to bring in people from other areas in the cabinet that we knew we needed their input in order to move forward. And so there was this very, this big priority on communication and transparency and collaboration. And so that just gives you a picture of the organizational structure. This just goes through, we had well over 100 people in this planning phase that we've been in for the past 11 months. This is our timeline that we've stuck to, and we are on target in terms of finalizing our work plans and moving in toward implementation. We do have this, this is kind of where we are now. We're working on work plans. We are still posting in MS Teams. We have a lot of communication tools that we're finalizing and moving forward. We're integrating all of this into the new strategic plan and moving forward. And we're discussing and are finalizing what the implementation phase is going to look like. As part of the slide deck, when you get that, you're going to also get this one-page overview of public health transformation. You're welcome to replicate it, use it with your partners if you want to find out more information about public health transformation. And just a couple of comments about what transformation looks like right now in practice. As I've said, we've spent a lot of time on the process and on the planning, and I fully anticipate as we move forward, we'll have a lot more examples during the implementation phase. But just to kind of give you an idea of what we're looking at right now, I want to point out we certainly are strengthening our partnerships even today with the foundation, but also with the Kentucky Primary Care Association, the Kentucky Health Department Association. And so we know that there are more partners out there that we want to engage. As I said, we've engaged national technical assistance through ASTO. Women's health has probably made the most radical change and transformation. Before we got on the call today, one of your speakers is from Muhlenberg County. And in that county, the health department director called and said, we want ideas on how to move women's health away from our local health department, but we still want it to be available in our community. So we've partnered with an FQHC down there. We're looking at grant funding for health departments as they look to some of these local priorities. And we're also looking at different trainings that we typically offered and are changing those. So I know that this has been a lot. It's a very complex set of processes and initiatives that we're looking at in Kentucky. I think that I'll have an opportunity maybe to come back and go into a little bit more detail. And I think Rochelle's going to talk about that. But that is my contact information. And with that, I'm going to turn it over to Jessica.
Jan. Hi, everyone. I'm Jessica Browning, and I'm not on mute any longer. I am the marketing specialist at Owensboro Health Muhlenberg Community Hospital and the chairperson for the Muhlenberg County Health Coalition. Today, I've been asked to discuss our experience as we collaborate with community partners, including the excellent Muhlenberg County Health Department and their director, Kathy Bethel, who happens to be on today's call. So how did we get started as a coalition? During our 2018 Community Health Needs Assessment, or CHNA, one of the identified health needs was our residents, specifically the vulnerable population, lack of knowledge about available community and health resources here in Muhlenberg County. I would guess that our other priority areas look similar to those identified needs in each of your communities as well: obesity, mental health, substance use, and youth issues. As a health system, one of the ways that we chose to address the lack of knowledge about resources was to pull together a local health coalition. The initial plan for these coalition meetings was to discuss what we currently knew about the health of Muhlenberg County and how our organizations might be able to work together to improve that. Each coalition meeting includes a little time of sharing what each of our organizations are doing now and ways that we may be able to partner together. We take this information back to our separate organizations to share with our colleagues, patients, and friends in the community. Our first meeting was held in February 2019 here at our hospital. We were happy to host the initial meeting, but wanted to be sure to offer the opportunity to host these meetings to other organizations as well. It was important to us that the coalition was a community initiative and not just an Owensboro Health Muhlenberg Community Hospital initiative. We invited 29 people to the first meeting and were thrilled that 15 attended. This included a representative from our local health department, school system, mental health organizations, EMS, county officials, and hospital executives. After our first meeting, our coalition declared that our mission would be to improve the health and educate people in Muhlenberg County by addressing identified needs from the most recent Community Health Needs Assessment. We knew the Community Health Needs Assessment priority areas would be updated every 3 years per IRS and Affordable Care Act regulations, so this would allow our coalition to stay current with what is needed here in Muhlenberg County. Our initial objectives were to inspire a greater sense of community among the many organizations involved in the Health Coalition, to share information about projects and programs that affect health and wellness, educate our citizens on the importance of healthy choices, and to establish committees to focus on issues that may arise. At each coalition meeting, the progress of these committees is communicated with the group, and follow-up meeting information is shared so that members of our coalition can join committees at any time. Involvement in these committees has helped our coalition membership stay active and invested. Committees that have formed include our Communications Committee. Members of this committee developed a logo and created a Facebook page to share information with all Muhlenberg County Health Coalition members and allow them to access and post about their organization's upcoming programs, events, and activities. From there, we can share that post on our personal pages, on our business Facebook pages, or just print the flyers to post in our offices. Another committee worked on a resource guide. They updated an existing mini resource directory that was duplex printed and folded to be brochure size. The committee secured funding to print 25,000 copies of this to be distributed as an insert in our local newspapers, in each box of food given out at our local food pantry, and sent home from school with each kindergarten through 12th grade students. These resource directories were also made available at each of the partner organizations within our health coalition. The information was also published electronically on our Muhlenberg County Fiscal Court website. And we all know once a document is finalized and printed, it can very quickly become out of date. So the coalition was also provided information about how to be included in 211, an online resource directory which has recently become an option for Muhlenberg County in the last few months. Another committee was working on housing, or is working on housing. They have worked to identify root causes and possible solutions to the housing disparity and homelessness in our community. Since Muhlenberg County does not have a homeless shelter, the committee has worked to compile a list of landlords and affordable housing options locally. They're also working with Room in the Inn from Bowling Green on their approach to housing the homeless, which involves partnering with local churches and organizations with available space to work out a rotation to house homeless individuals and their families one night at a time. Recently, a grant was written to cover the cost of transporting those in our community with immediate housing needs over to the closest homeless shelter, which is the Salvation Army in Madisonville. We also have a coalition member who has received funding and is currently awaiting more funding to purchase a property to be used for transitional housing in our area. Our transportation committee has secured funding from both our hospital and the Felix E. Martin Jr. Foundation, which is a local philanthropic organization, to offset the cost of transportation in one of our county's PAC vans. People can travel for work, school, or medical appointments for just $4 round trip. Another committee is working on 2 separate Health Expo events at our local library. The original plan was to have different organizations provide speakers for multiple workshops throughout the day and have booths set up with giveaways and additional health and wellness information. These health expos were scheduled for March and April 2020. Those times obviously proved to be a terrible time to gather together in groups, but the planning has continued and we hope to be able to reschedule these next year. This wasn't exactly a health fair, but our Health Coalition does promote, and many of our member organizations participate in community resource days. These are on the first and third Tuesdays of each month, and we gather to sort of set up a one-stop shop style resource center so that those who are needing assistance in our community can get taken care of all in one place. All right, so since its inception, the Muhlenberg County Health Coalition has been thrilled with the growth that we've seen. We have continued meeting in person monthly, and different organizations from within the coalition would host at their locations as space allowed. This allowed us to get a glimpse inside their work environment and helped to reinforce that the Health Coalition was a community project, not just a hospital project. We settled on the third Monday of each month at noon so we could all block our calendars, and the only thing that would change each month would be the location. Detailed meeting minutes and applicable attachments were emailed out after each meeting to the entire coalition. This email list included anyone who had ever expressed interest in the committee or attended a meeting. We keep this list growing, and it's still growing. These meetings continued, and attendance grew in number from 15 to almost 40 people. Our last in-person meeting was February 2020. So in March, like many of your organizations, we flipped the switch to virtual meetings. From March until June of last year, we felt like information was changing so frequently that we needed to meet more often. We switched days from Mondays to Wednesdays at 9 and began meeting weekly. In June, we began meeting bi-weekly. It felt like we were starting to settle into our new normal. And since August 2020, we've been able to continue meeting just monthly via Zoom. Our number of attendees has held steady around 20 to 25. And though meeting virtually has been wonderful, this group of smiling faces that you see, this was our coalition meeting yesterday, we are looking forward to being able to get together in person soon. So why is coalition collaboration crucial for communities? Our collective group of coalition members was able to accomplish so much more than our individual organizations could have possibly done alone. Just by attending each meeting and sharing with the group, our coalition members directly contributed to our community health needs assessment #1 priority, lack of knowledge about available community and health resources in Muhlenberg County. The information sharing, creation of the resource guide, participation in community resource days, funding assistance that was received, all these things were accomplished just by collaborating with our coalition members. So for my final slide, I wanted to share what lessons I've learned over the past year and a half of having these coalition meetings. I decided to make an acrostic, MCHC, for Muhlenberg County Health Coalition. M is for maximizing your contacts. Our coalition members are great about adding new faces into the mix. So I would encourage you at your next coalition meeting to look around the room or look around the Zoom and ask yourself who's missing. Should you invite another organization to participate? Are there other individuals within the existing organizations that might benefit from being part of the coalition? Even if they're not able to attend the meetings, I think it's important that you get them added so that maybe they can read the follow-up minutes or ask questions as they see fit. So C is for committee involvement, trying to get everyone on the coalition involved in one specific committee or project that they're passionate about or that closely pertains to their job. This will keep them plugged in and active in these meetings. H, honor the mission. Why do we have a coalition? Remember why the coalition got started, or maybe why you plugged in the first place. Knowing that your efforts matter and are impacting others in the community can make a big difference. I have never been to a health coalition meeting where I haven't learned something that's happening or been able to watch other organizations connect the dots to be able to help one another, and that is fulfilling. Finally, C stands for consistency is key. For us, that has meant sending monthly sending monthly meeting reminders the day before meetings, sending out complete meeting minutes afterwards. We've tried to keep times the same, so even though when we switched from in-person to virtual, we tried to always meet the second Mondays at noon in person and on Zoom the second Wednesdays at 9. It's important to stay the course, even when attendance may drop, and we have seen some months where attendance did drop. Every coalition meeting has proved to be helpful to at least one organization, so it's worth doing, and usually your attendance will rebound next month. All right, so I hope some of what I shared has been helpful to you and your coalition efforts. I appreciate your time. At this time, I'm going to turn the call over to Caitlin from Purchase Health Connections. Welcome, Caitlin.
Sorry, guys. I don't know why we went over it prior to starting and it just didn't work out right. So I hope everyone can see my screen. I'm Caitlin Krolikowski. I'm the Network Director of the Purchase Area Health Connections, and I'm with the Purchase District Health Department. So the Purchase Area Health Connections is a regional coalition that serves many counties in far western Kentucky. And so it serves McCracken, Marshall, Callaway, Carlisle, Ballard, Hickman, Fulton, and Graves originally, and then we've added Lyon. Okay. Alrighty, and so I'm going to go briefly over some of our history here. So the way that we're kind of formed is we have a board, like an executive board, and then we have task forces that go towards each specific thing that we've identified as initiative. And so the way that we started was in 2011, everyone was doing their needs assessments and realized that everyone was doing a needs assessment. And it made the most sense if everyone started working together and kind of, you know, shared assessments, had the same questions, or worked together with one assessment. And that was ultimately the goal, to have one regional assessment and share the information out to different people. And so then after that meeting, different partnerships started to form. It was kind of like a catalyst moment. And they started to form, and we started to see single county health coalitions. And then in 2015, about 4 years later, we started to formalize the actual regional purchase area health connections. And so at that point, we applied to our HRSA planning grant, and the planning grant was for like a network building and to plan out our community health worker program. And so that was really our first program. And so after we received the grant, we, you know, formalized, So after that, we applied for another grant. And then in 2017, we received that grant, and that was another network development and for us to actually implement the community health worker program. And along with that grant, we also created a community resource guide. We found that that was a problem in our area as well. And so what we had done is we had the pamphlets in all the different counties, and we took those and we collected them all into one large one and made a searchable online database. And so now you can search online. We provide cards with the QR codes, and then we have the community resource guides that go out as well. And so I think that's an issue across all of Kentucky, it seems like, from what I keep hearing. So then after that, we applied for a couple other grants. And so we did another planning grant and formed our Childhood Obesity Prevention Action Team, COPAT. And so in that one, we went around and we did BMI collections and found different resources that were specific to children with obesity, nutrition, physical activity across the spectrum of their lives, which was like, you know, in the household, at school, and different things like that. And from like pre-K through 8th with some different resources for kids in high school. And then after that, we then started to move towards opioids and substance use. And so that was something that we started, and we also continued our community health worker program as our two biggest initiatives. And so as you can see, we've been awarded a couple different grants over the timeline that we've had. Sorry, I'm trying to make sure that I get everything. And I know I talk fast. So the transitional care team, it started with 2 hospitals, and it started with our 2 regional hospitals in our area. And from there, what the point of the community health worker program, the CHW program, was to reduce avoidable hospital readmissions for COPD and pneumonia originally, while helping to address social determinants of health of those patients in the community. And so from there, we were able to expand, and we expanded to heart failure through a quality improvement grant. And then we expanded again to 2 additional hospitals and did the top 8 diagnoses that were causing readmissions within our area, and continued working to address social determinants of health. So then the other big initiative that we have is the Opioid Task Force. And so the Opioid Task Force has had a HRSA RCORE planning grant, an implementation, and then we have a BJA COSAP grant as well. And so the Opioid Task Force is kind of a broad spectrum. You know, we're doing the cascade of care model for opioid. And so it's prevention, identification, treatment, and recovery as like 4 separate entities. And within prevention, it is primary, secondary, and tertiary prevention that we are looking at. And so we've done a couple different initiatives within there. We have purchased an incinerator for one of our counties that's available for use for the entire region. We are doing different Narcan events. We've partnered with a local library to be a Narcan community hub center, so that people don't feel stigmatized having to go to the health department or go to a Narcan event. They can just go to the library. It's a community hub in our area already, and just say to someone that they want Narcan. There's a video for them to watch, and they can be given Narcan. And so those are some of our really big. We're also doing fentanyl test strips. Those go out. We do a lot of education around those. We have partnered to increase data waiver trainings with universities in our area to have nursing students actually trained in SBIRT and the nurse practitioners trained in data waivers prior to graduation, so that they can then practice for their year and decide whether or not they're going to be certified. And so those are some of the really big ones. We're doTERRA bags, lots of education at pharmacies, just trying to really hit it hard. So I heard some like kind of reoccurring themes with Jessica's, and I think it's one of those things where it's like, it's very similar. So one of the things that I would like to say is, I think the biggest lessons that we learned was making sure that what you're doing aligns with your partners. You're going to get better participation. So when we have our different initiatives, we know which partners align. We try to draw partners in that we know align, so that we're working together. And so that we have different partners. So we have some partners that are on the board. We have some partners that are on different task forces. And so some will just be on one task force. Somebody is on all the task force. It all changes. And we have over 80 different partners. And so we always try to make sure what we're doing aligns with what that organization is doing and what they're trying to get out in their mission as well. And so constantly assessing your community. I couldn't stress it enough. We are always assessing our community, because you don't know what is the newest initiative. Where's the gap? Like, what is that gap? Doing environmental scans, just seeing what's out there, surveying people that live in our area. We do a bunch of different things. I know that communication was stressed a little earlier as well, but communication is key. And so always making sure that you're communicating with all of your partners, you're communicating with the public at large, and making sure that your communication is consistent, it's available, and people know that you're always there. The other thing is promote your partners. And I know that some of this kind of just seems like obvious, but sometimes it's hard to do when you're in the moment. And we serve a very large area. So that can be sometimes, you know, this is helpful. So promote your partners. So every time that I'm with someone or I'm talking to someone and they express that they have this need, and I know another partner is working on that same thing, or they may have a solution to help, I make sure I'm promoting that partner to this other partner so that you're creating a web. So even though like not necessarily like, you know, that they're going through you, you want the web because it doesn't matter as long as the work is getting done, who's doing it, and that everyone knows that it's getting done so that you're not duplicating efforts and maybe you can just be more comprehensive. And so this is like an obvious one as well, kind of in a way. Find the right people. Finding the right people is very, very difficult sometimes. And so if you have an organization and you know that that organization, you just need them to be in your coalition, you know it's going to be such a good benefit, but the person that you're talking to, you're just not getting traction with, just go to a new person. I mean, that's what we do, is we just keep going until we find that right person where it aligns and it's what they want and we can work together and it's a priority to them. The next thing is boots on the ground. And so when you work in a really large area, so like we're far, far Western Kentucky, and so we're centralized in Paducah, and that's kind of where our home hub is. But we have lots of very rural counties and other places. And so I know that this is something that rural counties feel about, like Lexington and Louisville, like, oh, that's Lexington, that's Louisville. In this area, sometimes people feel like, oh, that's Paducah, that's a Paducah thing. And one of the ways that we've been able to kind of mitigate that is by making sure that we're actually present in the county and we're present boots on the ground. If there is a community event, if there is something going on, making sure that we're there. If they have a need, that they've expressed that need to you, trying to make sure that you make that need happen and you find a solution and you work with them towards it, and not be someone that's just, oh, well, you should do this. You know, actually maybe rolling up your sleeves and getting your hands dirty and helping them find that solution. That's been one of the ways that we've been able to see buy-in in some of our like more rural communities that feel sometimes that they're left out. Because everything is always directed out like the bigger cities or the bigger areas, just making sure that those people don't feel left out and that you're there in person with them, sometimes well after COVID. So those are the main lessons learned that we have. And so thank you very much. If you have any questions, feel free to contact me, or you can contact Kayleen Cornell. She is the project director of the CHW program. Thank you. I'm sorry if that was a little fast.
Thanks so much, Caitlin. Thank you to all of our presenters here today. Gratitude to all of your preparations. I learned a lot. Two of my favorite things was H, honor the mission, and Caitlin's comment. And then we realized everyone was doing a needs assessment. So I learned a lot today. A reminder that this afternoon, I'll send you a link to a post-event survey, and that Jan Chamness will be back on August 19th for a webinar with us, where we'll have a lot more time for questions and answers, and we'll really dig deeper into Kentucky's transformation efforts of public health. So we're just going to spend these last moments with you all, with our presenters, sharing some calls to action and concluding comments. I do want to thank all of you attendees for being here today. Please mark your calendars for August 19th. And all of this information about the Foundation's efforts are on the Foundation's website. So I'll turn over the call now to Jan to make her concluding comments.
Thank you, Rochelle, and thank you all for sticking with us and allowing us to have these important conversations. I think that I know that I probably overwhelmed you with public health transformation, and I know that there's some questions in the chat, and I'll be happy to address those in further on August 19th. But I think that just listening to Jessica and Caitlin, just you know, it just really encourages me and motivates me that what we're doing is in the right direction, and that it really points out and emphasizes the importance of building strong community coalitions so that we can really share in this process of moving forward and improving the health of Kentuckians.
Thank you, Rochelle, for sharing the slides today. My contact information is actually on the last slide of my presentation, and I'd be happy to answer any questions or chat with you more in depth about our coalition activities, and I'm open to learn. We are still in infancy as far as coalitions go, just a year and a half in, so I'm happy to learn. So if you have ideas for us after what you've heard today, I'd love to hear from you. I'm excited that I was able to be a part of the webinar today, so thank you for inviting me, and thank you for the work that each of you all do in your health departments around the state of Kentucky.
Also, thank you so much. I'm so happy to be here. I'm sorry if I talked a little fast for everyone, but definitely feel free to email me about anything. I'm happy to be involved. I'm also happy to learn new things and just very excited to be doing this work and to be able to present to you about it.
And I would like to, as we're closing, to say thank you to everyone as well. I feel so proud to be able to offer the information that these coalitions have shared. It's just the beginning. There's lots of good work going on in Kentucky. And so I hope we can do more of these to where we can highlight the work and learn from each other. In our work with SEDIC, what we hear, people want to hear what's happening in Kentucky, what's working in Kentucky. And I think it's kind of what you alluded to, Caitlin. It's not that they want to hear about something from Los Angeles. They want to know what's happening and what's working here. So thank you. Jan, thank you for educating us on public health transformation. And I loved the strategic mindset concept that you shared with us. And Jessica and Caitlin, keep the good work going. I'm happy to have partnered with both of you in different ways. Rochelle, thank you to you and the foundation for this webinar and for all that you do for promoting health for a change. And thank you to all of our participants for joining us today. That's why we're here, and we appreciate the time that you spent with us today.
Gratitude, everyone. That concludes today's webinar. I hope you have a fantastic day. I'll send you an email this afternoon. Take care.